just wanted to welcome everybody here today, and you may be wondering who I am. I'll let you know in just a moment. So welcome everybody. It's about time. I think we'll get started. Thank you for joining us today, and I just want to thank our guest speaker Karen and also our host from Parkland on the Glen, Grace. My name is Chloe Henderson, and I'm the Sales and Marketing Manager for Parkland. I'm actually here in our home office in Halifax, Nova Scotia. So I'm in a little different time zone than all of you. So I keep saying 1 o'clock, but it's 12 o'clock for probably most of you in Ontario. Before we begin today, I did want to just say hello and introduce our guests and give a very brief introduction to Parkland for anybody who maybe isn't familiar. I would guess most of you have an idea of who we are, but Parkland Lifestyle Residences is actually based here in the Maritimes. We started in Cape Breton, Nova Scotia, and over the past 33 years, we've been expanding throughout Nova Scotia into New Brunswick and more recently into Ontario in the last few years. And we've been providing support and focused on wellness for our seniors for decades now, and we've certainly learned a lot along the way. And we offer a range of lifestyle options to meet those individual needs of our residents. We have very amazing, well-trained team members and the most beautiful residents in our campuses. In Ontario, as you might know, we have Mississauga and Etobicoke, and we're currently building in Ajax and Ancaster as we speak. Construction in Ajax is coming along very well, and in Ancaster, I'd say we're just moving some dirt around at this time, but progress is moving along. So we are certainly expanding, and I want to give that introduction just so that you know that we are not new to this field. We've been doing it for about 33 years. I could go on, but today that's not why we're here. I do want to pass it over to Grace, and she's going to introduce our guest today. So Grace, I'll hand it over to you. Thank you, everyone.
Thanks, Chloe. Welcome everyone this afternoon to this session of Parkland Live. So today I'm very excited to be introducing Karen Sukhu, who is the Learning Solutions Specialist with Home and Community Care Support Services. Now, you may know them from their former name, the LHIN, which was the Local Health Integrated Network. In April this past year, they have changed their name again. So Karen is here as a lifestyle consultant here at Parkland on the Glen. I'm always asked questions about what services home care support can provide our residents, people moving in, what services they can be provided, the track to long-term care. So I thought I would bring in an expert to address these questions for you. So Karen, she's been working with home community care support services since November 2000 in various locations. Most recently, she joined the learning development team as Learning Solutions Specialist. And prior to this, she was a care coordinator in the placement department. So she knows the systems very well, being there for almost 20 years. So Karen's going to do her presentation. I would ask anyone who had any questions if they could wait to the end, either raise your hand or put it in the chat box, and then I will ask those questions to Karen. So Karen, take it away, please.
Oh, Grace, thank you so much for that beautiful introduction. And thank you so much, everybody, for allowing me to share some knowledge and participate with this Lunch and Learn. I really appreciate it. So I'm going to, no further ado, as I know we only have an hour and I can be a little chatty Cathy, I'm going to start to share the presentation and let's get going. Okay, so bear with me while I get familiar with Zoom. Can we all see the presentation now, the home and community care screen?
Yes.
Beautiful. All righty. Okay, so before I start the formal presentation, I would just like to put a note that all of the information I'm sharing is current and up to date as of the time of the creation of this presentation. However, as home care evolves and the pandemic situation evolves, this can change without notice. All of the services, all of the eligibility, the pandemic rules can all change without notice at any time. I just wanted to start off with that part. Okie dokie. So what we're going to be covering today is home and community care support services, quality care at home, and home includes your retirement home, housing options, when more help is needed, and the long-term home care process. And at the end, we'll do some Q&A questions. All right. So as Grace mentioned, our current name is now the Home and Community Care Support Services Mississauga Halton. This map, as you can see, it's not to scale, and South Etobicoke unfortunately does not cover Parkland on Eglinton. That is under the Central West Home and Community Care Support Services catchment area. So their services and eligibility could differ from Mississauga Halton's at this point in time, depending on staffing, wait lists, and things like that. Home and Community Care Support Services Mississauga Halton is just one of 14 home and community care support service organizations in Ontario with the focused mandate to deliver local healthcare services such as home and community care and long-term care home placement. These organizations were previously known as the Local Health Integration Network at a time when they also led local healthcare planning and funding, and those functions are now part of Ontario Health. Home and Community Care Support Services is dedicated to ensuring the ongoing delivery of local services while Ontario makes changes to improve the healthcare system to give patients better connected care with healthcare providers working as one coordinated team in Ontario Health Teams. Our name has changed, but services and contact information remain the same, including home and community care, long-term care home placement, and help finding services and local doctors. Home and Community Care Support Services welcomed Joe Parker as the new board chair and Donna Cripps as the interim chief executive officer to lead Ontario's Home and Community Care Support Services organizations effective July 1st, 2021. And each Home and Community Care Support Services organization services one specific geographical area. This is the map that we've shown for our particular area in the Mississauga Halton. And Mississauga Halton is made up of 7 sub-regions, which include Halton Hills, Milton, Oakville, Northwest Mississauga, Southwest Mississauga, East Mississauga, and South Etobicoke. And we currently service a population of about 2 million people. So that's just a brief history of who we are and what's going on. Now, this is the good stuff. So in-home healthcare. In-home healthcare may include, based on eligibility and need, nursing in our community clinics or in-home, personal support, which is typically the bathing and dressing, just to define that, physical therapy, occupational therapy, speech and language therapy, social work, dietitians. But please note, during COVID-19, some services are still available but may vary. Home and community care core services also includes home care services for post-acute, long stay, and palliative clients, long-term care home placement, and referral and navigation to other community services. So, for example, if you have a wound and you're mobile, you can we can arrange the clinic so that you can have an appointment time, go have your wound taken care of and come back. For those who cannot access a clinic, then services can come into the home, for example. So during COVID-19, protecting community patients, families, staff, and visitors is our main priority. Provincial government and healthcare system continues to update our guidelines and policies to ensure the safety of those across our communities. Services are still available, but please be aware they may vary based on, again, staffing issues, the pandemic situation, things like that. So home and community care options, community-based services, there's meal services such as Meals on Wheels, Heart to Home, friendly visiting, transportation services, adult day services to help patients stay in their home longer, links to care, and more comprehensive support are supportive housing, assisted housing, retirement homes such as Parkland on the Glen, short stay respite, long-term care home, retirement home, or community setting, and long-term care when all community options have been exhausted and permanent housing based on complex care needs is required. Now, the only thing I wanted to mention is that currently due to the pandemic, the short stay respite is just currently on hold with respect to the long-term care. Hopefully that will resolve soon. Now, we also have some specialized programs such as convalescent care, which is short stay in a rehab treatment program in the Mississauga-Halton area that is in our Cooksville long-term care home. Again, due to the pandemic, this program is currently on hold. Hopefully, it'll open soon, but right now it's on hold. There are some special behavioral support units in our long-term care homes. So individuals who have a lot of responsive behaviors and we can't manage them and get them under control in the community can go to these areas and have a little bit more intensive care and then eventually get placed from there into a long-term care home, depending on their situation, or return to the community. There's Behavioral Supports Ontario. We have rapid response nurses, palliative care, a nurse practitioner support team to avert transfer into long-term care or into hospitals, and mental health and addiction nurses. So there's a lot of specialized programs. However, to be eligible for in-home services, you must have a valid Ontario Health Insurance Plan OHIP card, healthcare needs that cannot be met on an outpatient basis, a need for at least one professional or personal support service, a medical condition that can be treated in the home or at a home and community care support services nursing clinic. So housing options include senior housing for seniors apartment or supportive housing. There are retirement homes and long-term care homes. And just to be aware, there is typically a wait list for supportive housing. Seniors apartments are equipped to support the needs of seniors and subsidies are available. Supportive housing can be arranged through Peel Living or Halton Access to community housing or the Hatch in our catchment area. And the home will provide additional supportive services. So for example, we have Hillside Place, Oakville Seniors Citizen Residence. And additional support services includes assistance with personal care in these settings, volunteer visiting, security checks, medication reminders, and help with meals. And it's arranged through Peel Senior Link or Halton Access to community housing in the Mississauga-Halton Home and Community Care Support Services catchment area. Retirement homes are amazing. They provide varying levels of assistance with services such as meals, laundry, and housekeeping. They are privately owned and operated and do not receive funding or licensing from the Ministry of Health and Long-Term Care. They are regulated under the Retirement Homes Act by the Retirement Home Regulatory Authority. Cost for accommodation varies depending on the home selected and the level of care your loved one needs. And there are some resource websites at the end of the slide here. Hopefully, Grace, you'll be able to post them if needed or share it going forward. And the only other thing I wanted to mention is that even if you reside in a retirement home, you are still able to access home and community care support services based on eligibility and care needs. The only thing is we don't duplicate. So, but the home and community care will work with the retirement home to find a care plan to help support you to stay at the retirement home. Does that make sense, I hope, so far? Alrighty. Now, the long-term care home part provides a wide range of services for people who can no longer live independently, including nursing and personal care, regular and emergency medical care by the on-call physician, treatment and medication administration, assistance with activities of daily living, and 24-hour supervision. Room and board, including laundry services, special diets are also accommodated, pastoral services, and social and recreational programs. All long-term care homes are funded by the Ministry of Health and Long-Term Care and are governed by legislated standards. And recently, I saw that they are opening up the recreational programming in the long-term care home now that we're entering stage 3 and the pandemic is getting a little better. But again, subject to change based on the evolving pandemic. Long-term care home placement and referral. So the Long-Term Care Homes Act and Health Care Consent Act govern admission and choice process. Only placement coordinators can determine eligibility based on applicable legislation. Applicants can choose up to 5 homes in Ontario and must consent to those choices. But if you're in a crisis situation and crisis approval has been obtained, you may, but are not required to, pick more than 5 homes. So they remove that 5 home limit if you're in a crisis situation. Consent must relate to admission, be informed, and be voluntary, and not based on misrepresentation or fraud. So the person that is looking to enter long-term care, or the family who wishes someone to enter long-term care, everyone needs to be on the same page. There's no putting someone on the wait list without consent and knowledge. Common signs of long-term care readiness: patients become resistant to care and medications, change in the patient's medical stability, caregiver illness, interrupted sleep, etc. Limited appropriate respite options, for example, overnight or in-home respite. Patient or family verbalizing concerns over the ability to cope. A change in family support. Nutritional hydration issues, caregiver illness are also things to consider. And then touring the long-term care homes on our YouTube page, on the YouTube app, you can actually video tour all of the homes in the Mississauga-Halton region, and there are 27 in our area, so that you can get a sense of what it looks like ahead of time. Now, these videos have yet to be updated, so some of the older homes will still show 4 persons per room, but the legislation has been changed to only where basic is 2 persons per room, so that's something to keep in mind. Eligibility for long-term care. The patient needs to be 18 years of age or older. They need to have a valid Ontario Health Insurance Plan OHIP card. We need to exhaust all publicly funded community-based service options. They need to be a risk to themselves or to others. They need frequent monitoring and assistance. Requires 24 access to nursing, and care needs can be met in a long-term care home setting. And I just want to make sure that I covered everything here. So placement applications can be made from the hospital or community. Referrals can come from a family physician, service provider, day program provider, patient, family, neighbor. Please note a physician referral is not required. All applicants can receive an assessment. However, this does not mean that somebody is automatically eligible for long-term care. Eligibility criteria must be met. The eligibility for long-term care is based on provincial regulations set out by the Ministry of Health and Long-Term Care. If a patient is found to be ineligible for long-term care, and if patient's family are unhappy with this determination, they can follow the appeals process through the Health Service Appeals and Review Board. And we'll review the appeals process at the end. Long-term care assessment. There's a physical and mental health assessment by the doctor or registered nurse. Requirements for medical treatment and health care. Functional cognitive capacity. Requirements for personal care. Current behavior and behavior during the previous year. Any other assessments or information provided for in the regulations, geriatricians, adult day program providers, etc. So if somebody had taken a respite at, for example, Nora's house, we would contact Nora's house to get a summary of how they were managing in that respite site so that we could share it with the long-term care home so they would get a better sense of how that person would manage in a congregate setting, a different congregate setting. Starting the application to long-term care. You request for a placement assessment. If the patient is new to home and community care support services, an intake assessment is completed by a care coordinator over the phone. You can make the referral by phoning in our main number, extension 0, both for Mississauga-Halton or Central West, to get the process started. It's always good if the patient or family start the process so then you can get the consent figured out right away. The patient is then assigned to a care coordinator in the community who will visit the patient's home to assess for eligibility for long-term care and determine the patient's capacity. If the patient is in hospital, a social worker or discharge planner will start the process by sending the referral to the Home and Community Care Support Services Hospital Care Coordinator, who will then complete the placement application and determine eligibility at that time. So if you have a loved one in the hospital and you call the home and community care, until that referral is made, they're not allowed to access that file for PIPA for privacy health purposes, I believe. Assessment of capacity. If the patient is capable, no one else can make their decisions. If the patient is found incapable, they must be provided with advice about their rights. They can apply to the Consent and Capacity Board to challenge the findings of incapacity, and they must be advised that substitute decision maker or their power of attorney will now be making decisions for them in compliance with known wishes. So part of the long-term care capacity assessment, the care coordinator is to determine, so what the care coordinator is trying to determine when assessing the capacity is the individual's ability to understand the information that is relevant to making a decision about admission to long-term care, and the ability to appreciate the foreseeable consequences of a decision or lack of a decision. If a person is deemed incapable, so the substitute decision maker or the power of attorney will then act on that person's behalf, but we will require a copy of the power of attorney for personal care. If the power of attorney is joint, we will require the signature of all attorneys on the consent and facility choice form, as well as a verbal response at the time of the bed offer. If there is no power of attorney and there is no spouse and there's multiple children involved, all parties will need to sign all documents. Who can be a substitute decision maker? The guardian of the person with authority for admission decision, attorney for personal care with authority for admission decision, representative appointed by the Consent and Capacity Board, spouse or partner, child or parents or children's aid authority or the other person lawfully entitled to give or refuse consent, a parent with right of access only, a brother or sister, any other relative, and if there is no person according to this list, and it's based on the hierarchy, so 1 to 9, then we go to the Office of Public Guardian and Trustee to have them take over if there's nobody else. We really try to have somebody involved with the family member or the patient be part of the decision process. Application review process, the overview. So there's eligibility and urgency is assessed. It's determined by home and community care support services based on regulations. The applicant selects up to 5 homes. If you just want the one, you can have just the one. Applicants sent by home and community care support services to chosen long-term care homes for acceptance. So all of the information that your care coordinator is gathering is then shared with your homes of choice. And there are many documents in this application. We've got our demographic data, capacity assessment, consent, the medical report, the inter-RI assessment, which is the assessment tool the care coordinator uses, the behavioral assessment tool, the long-term care choice form, and any and all appropriate consult notes and additional reports. The long-term care homes will then review the application and will either accept the individual onto their wait list or reject. But there's only 2 reasons that they can reject. The long-term care home cannot provide the nursing care, or the physical setup of the long-term care home cannot accommodate the application. Wait times vary and fluctuate based on many factors. Approximate wait times for long-term care can range from months to years, and we have multiple admission categories, which determines how patients are categorized, and they also influence the wait times. So crisis admission is the fastest category if the person is at significant risk or there's a crisis situation going. We've got spousal admission. So if one person is already residing in a long-term care home and the spouse in the community requires long-term care and wishes to join their spouse, that's where that category falls in. So they get a little bit of a higher priority than the regular wait list. Anyone who's on a special behavioral unit gets a category 2.1 once their behavioral treatment is completed. Then we have the ethnic, religious, linguistic categories for our ethnic specific homes. So if you are Italian and wanting to apply to Villa Forum, then that's where that category would apply. And then our regular other category is 4A, 4B. And then we also have a special category for veterans and readmission. So as you can see, there is a cost associated with long-term care. So for a basic accommodation, which is now up to 2 persons in a room, you're looking at this moment in time, $1,891.31 per month. And only with the basic accommodation can an individual apply for rate reduction if their incomes does not meet that $18,000 or $1,891.31 per month. The semi-private and private. So some homes have semi-private accommodations, some homes do not. All homes have private accommodations. And the difference in the pricing here is if it's a newer home versus an older home. And the other thing I wanted to mention is that the cost tends to increase around July 1st typically. However, the government did freeze it last year due to the pandemic response. So this price may go up this year. I have no idea yet at this point in time. COVID-19 restrictions and guidelines. Protecting community, patients, families, staff, and visitors is the main priority. COVID-19 restrictions and guidelines are subject to change without notice based on the evolving pandemic situation. And although restrictions have currently eased regarding Ontario long-term care homes, each home will make the decision to implement changes based on resident stay safety. So if they can accommodate, they will. Important reminders. Please follow up with the home directly to find out about their current admission visitation policies. COVID-19 testing is mandatory prior to admission. Families, patients must work with the community care coordinator to complete testing in a timely manner before admission. Having COVID-19 positive test results will delay the admission. And you need to be prepared, although things are getting better, so this may or may not still be valid, but be prepared for the possibility that you may not be able to visit your loved one for 2 weeks after they are admitted, or that the essential caregiver may be limited to 2 per family. Things look, from what I saw in the media, things look like they're improving, but again, it's based on home to home and how they're able to manage. I just want to make sure that homes that have experienced a COVID-19 outbreak have been very cautious, and families may not be able to visit to support transition during the pandemic due to guidance. Things are very fluid at this time. We encourage you to be as flexible as possible. And that's pretty much all of the notes on that section. So COVID testing for long-term care. Long-term care homes will COVID-19 test the patient upon admission to the home, or patients need to be tested and have a negative result prior to the transfer. Some areas require within 24 hours of swab results unless previously confirmed infection and cleared within a 90-day period. A copy of the COVID negative results must be sent to the, should be reading the long-term care home of choice prior to transfer. Long-term care homes must be aware of negative COVID results, and a copy of the results must be delivered with the patient on admission. So some homes will do it themselves. Some homes will require this done ahead of time, and they will still test once you're there. They will have an isolation period. So for fully immunized residents, a lab-based PCR test is required at the time of admission transfer. The individual must be placed in isolation on droplet and contact precautions if the test result is pending. If the test result is then negative, then isolation and droplet contact precautions can be discontinued. If the test is positive, isolation and droplet and contact precautions must be continued. And fully immunized is defined as the individual has received all doses of their COVID-19 vaccine series, in other words, both doses of a 2-dose vaccine series or 1 dose of a single-dose vaccine series, and more than 14 days have passed since the receipt of their last dose. For partially immunized or unimmunized residents, a lab-based PCR test is required at the time of admission transfer, and the resident must be placed in isolation on droplet and contact precautions for a minimum of 10 days. A second negative lab-based PCR result is then collected on day 8, which is required to discontinue isolation and droplet precautions on day 10. Otherwise, isolation and droplet contact precautions must be maintained until day 14. Recently COVID recovered residents who are within 90 days from the date the test was taken from a prior lab confirmed COVID-19 infection are not required to be tested or placed on isolation or on droplet and contact precautions on arrival. If there is uncertainty about the validity of the recent COVID-19 infection, the long-term care homes must consult their local public health unit. Long-term care homes should be aware of the potential for ongoing positive lab-based PCR results several weeks after infection. Ontario has responded to the high levels of COVID-19 vaccination in many long-term care homes by making changes to help homes safely resume communal dining and social activities. Additionally, residents and their caregivers who are fully immunized may choose to have close physical contact beyond what is required for care and supervision, such as hugging. And I believe recently overnight visits and indoor visits have now been recently opened based on what I've seen in the media releases. Preparation for transition to long-term care. It is important to start planning for the transition to long-term care early in the application process. Patient needs to be aware they will be moving to long-term care. Take the virtual tour, consider what personal belongings to bring pending facility policies, and consider how your loved one's rooms can be set up to make them more comfortable pending facilities policies. So during the pandemic, the staff have been setting up the patient's room, working with the families on the telephone. Families can find out what activities or services are available and talk to their loved ones to focus on the positive. You can complete a journal, photo album, and/or memory box to bring to the home. Please have transportation arranged beforehand. And if you think there will be resistance to the admission, communicate this to your care coordinator early on to help with the transition planning. You also would like to talk to the family doctor about how to support the patient's transition to long-term care. Patients may be more willing to listen to their family doctor than a family member. Arrange to have support for yourself. It's helpful to take the day off of work. Try to get all your financial and legal paperwork in order early on, and work with the home social worker staff as to what's required. Family dynamics, try to work out any differences ahead of time if possible, and start to think about advanced care directives that will be discussed at the admission meeting. The reason that we also say to have support for yourself, it's very emotional for every party involved. So if you can have someone there to support you as well, whoever is helping their loved one move into the long-term care home, that's very beneficial. Bed offer processes and wait times. So currently we are unable to predict the wait times at this point in time in this current COVID-19 environment. Hopefully when things calm down, we'll be able to have more of an idea of the waitlist timing, but for right now, we are unable to give you a waitlist timing for our homes. At present, we are only admitting 1 to 2 patients per week due to all of the COVID-19 isolation precautions. There are some exceptions of crisis placement to long-term care homes from the hospital. For current crisis patients during the pandemic, if a bed offer is refused, the long-term care file will not remain open. Patients will be removed from the crisis list only if the situation is related to the pandemic. So they want a long-term care home bed, but they're concerned about the pandemic situation. You're just taken off the crisis list. You're still staying on the regular wait list for your choices. It's just those who are refusing crisis or refusing a bed offer for other reasons than the pandemic, the long-term care file will be closed. The long-term care homes currently are being very mindful in admissions. They're taking longer than what is on the wait list, approaching admissions with increased steps, checks compared to what we were doing before the pandemic, because they want the admission to be safe. Residents need to be admitted within 24 hours of a negative COVID result, different testing options. There's ambulatory clinics or paramedic testing centers if the patient is mobile, and home and community care supports services staff home visits. And the decision maker will be informed of a bed offer and needs to call back or confirm within 24 hours. So if I was the placement coordinator and I called Mrs. Smith, who is capable in her own right, to say that we have a bed offer for you at your first choice, do you wish to take it or decline? She may want to get back to me, or she may respond right away. You say yes within 24 hours, and then we get on with the rest of it. If we say no, we have to figure out what the reason why is and go from there regarding if the file will be closed or just removed off of crisis. Bed refusal. If one or of the 5 choices of a bed offer is refused by the patient substitute decision maker, the application is canceled and the patients are removed from all waitlists if it's non-pandemic related reason. If the patient is on the My Way Home program, their service levels may be affected. Patients may reapply after 3 months or sooner if the patient's situation or health condition changes significantly. Patients can be or may be reassessed within the 3 months if that's the situation. Vacation leaves and casual absences. Long-term care homes may gradually resume social absences and temporary absences. Residents who are in isolation on droplet and contact precautions and/or reside in an area of the home that is in an outbreak cannot participate in essential, social, or temporary absences. Temporary absences include absences involving 2 or more days and 1 or more nights for non-medical reasons. All residents returning from a temporary absence must be tested and isolated on droplet and contact precautions, if applicable, as per the admissions and transfers section above. So again, as the pandemic is evolving, so are the testing requirements. So this might change even this afternoon or tomorrow, who knows? So we have a few resources available to you that's included in the slide. I'm sure, I hope Grace will be able to share this with everybody later as needed. Okay, I see the nod, awesome. Now
Not
the
a problem.
thank you. And the patient complaint and escalation process. So I just wanted to mention this in particular. An expression of dissatisfaction can be expressed by the patient, caregiver, or an external advocate. Either party can seek the review of a court if unsatisfied. We have patient relations, the Advocacy Center for the Elderly, the Long-Term Care Action Line, or a hospital ombudsman within each hospital. But essentially, start with your care coordinator, which then goes to the manager director. Then there's a process: patient relations, then the CEO, and then the SHARB. I think that was the oh, I forgot what the acronym stands for. It was in a previous slide. Sorry. If this does not resolve your concern, residents' family can report concerns directly to the Long-Term Care Action Line. It's anonymous. So any complaints about care or other concerns should be initially addressed with the charge nurse in a long-term care home, if possible. If the concern is not resolved in the long-term care home, then residents or families are encouraged to follow up with the director of care, the administrator or social worker at the long-term care home. Then you call the long-term care action line if you see anything in a long-term care home that's concerning or dissatisfied. And that is the end of that. Any questions, anybody?
Thank you, Karen. That was a lot of information, I know. Hopefully everyone digested it. There'll be a test later. We do have some questions on the chat. We have a 3-part question, so I can address the first one, Karen, and then I'll ask you the other 2. The first is there cluster care PSWs and respite day programs available at Parkland on the Glen through home and community care? So Parkland on the Glen and Eglinton both do have cluster care for PSWs. So that means that we have just a few PSWs or personal support workers working with many of our residents throughout the building. So that means we don't have so many people coming in to assist our residents with what we call AM and PM care or bath assistance. So we have really worked hard with our LHIN manager and actually the care provider, who's care partners, to minimize the number of PSWs coming into our buildings. So that's what's called cluster care. With regards to the respite day programs, we do have respite available or short-term stays, but that's not through home care access. That is privately done through Parkland on the Glen. Currently, because of COVID, our minimum short-term stay is 1 month or 30 days. So if you'd like more information on that, definitely you can reach out to me and I can provide that for you. Now, the other questions are more specific towards you, Karen. The first is, for long-term care facilities, how is the fee structure changing from semi-private versus basic fees, since the rooms will no longer allow for more than 2 people?
Hi, so it depends on the home. Some of their semi-private accommodations will be your own room and a shared bathroom. So those are different than the basic, which is 2 persons, typically with a curtain and a shared bathroom. So it just depends on the home on how they're going to do that and revamp in the future as well. I hope that answers that question.
Okay. And then how many or what type of belongings should we prepare in advance for a move into long-term care? Does that include any furnishings?
So each home is different with respect to the room configuration. Some you can bring in an armchair and a big cabinet. Some it's only just a little TV. Typically, you want to have a week's worth of clothes, any personal care aids, any particular favorite blanket or belonging. But the best thing to do is to contact the social worker for the home and have a discussion with them as to what that particular home will allow and what their spatial configurations will allow.
Okay, perfect. And from the initial telephone call to home care, how long does it take to complete all the long-term care assessments?
Oh, that varies from situation to situation because we need to get a health report filled out by the family doctor, and that can be sometimes they're very, very quick, sometimes it's very long. We need to compile all of the consult reports and complete the assessment itself. So it can take anywhere from on a couple of days maybe to a couple of weeks. It just depends on the situation. It's really hard to give a specific timeline. But typically we do want to get everything done within 6 weeks, ideally, preferably less time if possible.
Okay, and then there's a question how to contact the Toronto Home Care Support. So I did put the number at the top of the chat, but for Central West, the number is 905-796-0040, and then it's extension 0 as Karen had mentioned for that access.
Did you want Toronto Central as well or just Central West?
What if you have Central, if you have the other number, if you could provide that, that would be great.
Yeah, so Toronto Central, for anyone who's looking for Toronto Central specifically, is 416-506-9888, extension 0. So extension 0 will always bring you to our intake department, and they can then start the referral process or find the person you wish to speak to and put you into their voicemail or connect you to them live.
Okay, the next question is, so I'm going to skip and then I'm going to go back. Is there an adult day program at Parkland on the Glen offered through home care? Unfortunately, there is not adult day programs. Karen, do you have a phone number, or is it through the intake numbers that they find out the locations of the adult daycare?
Yes, so we do have a day program application at Mississauga Halton, and I believe also at Central West. Again, Central West is not my home location, so I'm not familiar with all of their resources. You can phone into the intake department and get the ball rolling, at least even get the information to start before you can make a formal application to the day programs. Currently, they are all on hold due to the pandemic. However, it's looking like things are starting to open up. So hopefully, I'm hoping by September, the latest, we'll start to be able to get people involved in those programs. They are amazing. They are so much fun.
Oh, perfect. I know we have a few of our residents that go to adult day programs and they really benefit from it.
Oh, yeah.
There's a question here. Do you require all staff and all PSW workers entering Parkland buildings to be fully vaccinated? And if it's not required, how do you protect residents from infection? So actually, I have some information that was provided by our clinical lead, and she actually works with IPAC Canada. It gets pretty technical, so I'm just going to read off what we've been advised. So as much as we'd like to be able to require all employees and anyone entering the home to be vaccinated, we're not legally able to do so. So our approach has been to provide an extensive amount of information showing the importance of vaccination, and we'll be implementing a policy that if employees cannot show proof of vaccination, they'll be considered unvaccinated and required to complete a vaccination education program as part of our vaccination policy. For people who visited Parkland on the Glen, you do know that we do have a robust infection prevention and control program that incorporates many safety measures. Our employees are educated and audited on proper use of personal protective equipment and hand hygiene. And we do have screening when you first do come inside the building. So I hope that answers that question with regards to our policy at the moment. And as Karen said, things are always changing, so who knows, right? Any other questions? And then there's something, I'm not a clinician, so, you know, there's a comment here, vaccination does not ensure that a person can't transfer COVID. So I really don't want to speak to that because I'm just a lifestyle consultant. I won't lie to you. So, I mean, that is true from what I'm hearing, but I'm not sure, Karen, you want to comment, or you'd rather leave it to the medical experts to comment on that?
I'll leave it to the medical experts. I don't know enough about it to fully say yay or nay, and I don't want to put the wrong information out there.
I agree. I don't want to be quoted.
Yeah. Well, I don't know. I'm not an expert enough to know, and I don't want to, say something that's not true. That's not fair.
No, exactly.
Yeah.
That's how I feel too.
Yeah.
So did anyone else have any other questions for Karen with regards to the process for long-term care or how to access services? I know, Karen, I did have a question posed to me. So what if you are receiving services in your home, and say, for instance, I have an individual living in the community, but they aren't from our catchment area for their services. How involved is it to make a move from one area to another to make sure their services are transferred?
That's actually a really good question. So because of the pandemic response and funding and staffing and multiple various circumstances, not that all home and community care support services may not have the same services, or there may be a wait list for the service. But if, for example, they're living in Mississauga-Halton and they're getting bathing once a week, and now they want to move to Toronto, your care coordinator let him or her know that you want to move and what the date is. And then they will contact the receiving area to see what the service levels are like, if you can in fact just easily transfer over to the new agency, or if there's a wait list or what's going on. And then they will do all the paperwork and get everything going for you for the new area, for example, Toronto Central. And they will also communicate with you anything they find out with respect to agency names, phone numbers, contact information, things like that as well. So they can be very, very involved with that. Please do not just pick up and move. Please give your care coordinator time to work on these referrals and work out a nice care plan so that things are smoothly transitioned from one area to the other. Now, conversely, if you do just pick up and move, you can self-refer to the new area. And then the new area may ask the Mississauga area to share information accordingly once they find out and get things going. So you can still do it that way. It's just not as smooth, and you might actually go without service for a little while things are getting straightened out. The other thing I wanted to mention, if you are residing either in a retirement home or in the community, and you haven't been linked with a care coordinator, but things are changing and you want a little bit of help or you want some information, you can call into the Home and Community Care Support Services main line. As Grace had shared the number for both Mississauga-Halton or Central West, for example, for the retirement home areas, and make a referral, inquire about the information. Once there is an active file going on, they will link you with a care coordinator who will then assess you for your needs. You will likely be linked with your retirement home care coordinator, which is Fortunata on Parkland on the Glen, or Shani and Umisha at the Parkland on Eglinton, accordingly, so that they can work with you on a care plan and information sharing and things like that. But you need to call into our intake department line to get things rolling. However, if you're already linked with your care coordinator, you just call your care coordinator, ask your questions, share information. No matter what the question is, if you call at 3 a.m. in the morning because something is bothering you, it goes into the voicemail. It's okay. And then she will respond as soon as she's able to answer your question or find that information for you. So I used to tell that to all my patients before. Don't worry, call me. If it's bothering you at midnight, call. It's okay. It's not like you're going to wake me up. Call and leave a message. I will get back to you. Perfect. Or in other words, your care coordinator will get back to you. Sorry.
Thanks, Karen. Before we close off this session, does anyone have any more questions? I don't see anyone coming up. I think this was great. Thank you so much, Karen. Again, like I said, I'm just a lifestyle consultant here. So I'm glad you were available to answer questions about long-term care and services available, because I do get these questions quite a bit. So I thought I'd bring in the expert. So thank you very much for your time. Also wanted to let people know, these Parkland Live sessions are going on all the time here. We're having another one next Tuesday, July the 20th at 6 p.m. And actually it's about the benefits of music therapy. And actually, we're having the general manager from Parkland Riverview doing the presentation for that event. So if you're interested in finding out about the benefits of music therapy, go to our website, experienceparkland.ca, and register there. And we'll see you next Tuesday at 6 p.m. And if that's all the questions for today, I thank everyone for your time and have a great weekend.